I met Dr. Jeremy Gitau at the beginning of the pandemic. He was leading a team of doctors, nurses, and other healthcare workers at Kenya's main isolation center. 2 years after COVID-19 was declared a pandemic, Jeremy Gitau tells me handling the viral infection was quite an experience.
This is a patient you're telling, look, we're going to put you the tube. And the sad thing was, once you put them the tube, the chances of recovery from it were very low.
Africa has witnessed 4 waves of COVID-19 since March 2020. Each wave had higher peaks than the previous one.
Unawares, it caught us unawares.
Professor Oyewole Tomori, a Nigerian virologist, says that with each surge, African countries became smarter, faster, and better in their response.
When it finally came here in Nigeria or Africa, we really felt a big surge. But luckily for us in Africa, the epidemiology of the disease was different from what it was in Europe.
Dr. Gitau says with increased availability of trained healthcare workers, oxygen and other medical supplies, Africa's capacity to manage COVID-19 cases gradually improved. The number of ICU beds increased from 8 per 1 million people in 2020 to 20 in 2022.
I remember there was once we had a patient who had other underlying conditions, what we call chronic obstructive pulmonary disease. And after a few days of being on the non-invasive ventilation, the person was able to recover properly, and finally we ended up discharging them.
Experts say that Africa must now build on the gains that were made during the pandemic for the continent to be ready to face future pandemics.
Nigeria, like many other African countries, have seen that there's need to improve the basic healthcare delivery to our people. And on that ground, I think COVID has taught us to look far ahead in preparation for the next epidemic that will surely come.
He points at vaccine development and deployment as an area the continent should focus on. Uganda's Minister for Health, Jane Ruth Acheng, says there has been a problem with vaccine uptake.
There are pockets of areas where there is resistance to vaccination. And those are the pockets that we want to target and understand why.
Africa's biggest problem in dealing with the pandemic has been availability of vaccine doses, and with the continent struggling to inoculate people, several countries are in the race to establish vaccine manufacturing plants. They include Egypt, South Africa, Algeria, and Kenya.
We have done all the preclinical work in different animal models, including the macaques. We got the Egyptian Drug Authority approval in preclinical and also the approval to begin phase 1 trial. We began the trial, the phase 1 trial, since around 1 month. The volunteers who were injected are so far in very good health.
The efforts are geared towards making vaccines more available for the people across the continent. Enock, Sikolia, CGTN, Nairobi, Kenya.